Then there is the questions won't skip to the second team. Okay, just a one-way shot. In second round, we will have other two sets of questions. 3 ECGs will be there and 3 X-rays will be there. So if one team fails to say the answer, the question will skip to the next team subsequently. Third round is also like that, but it contains 3 sets of questions. It's purely with drugs, and the fourth round will be of buzzer type. Okay, the round 1 will be purely of clinical questions. So the questions are, everything has been crafted from the textbooks. There's nothing from bedside teaching or classroom teaching. Okay, everything is taken from the standard textbooks and articles. And the decision by us is the final thing. Okay. So coming on to the first question. Regarding pulse, which of the following is false? We have 60 seconds to answer it. So first is a dichrotic notch coincides with closing of aortic valve. Second option will be amplitude of pulse decreases with distance from the heart. Third is in bifid pulse of chronic AR, the percussion wave and the tidal wave are all with equal amplitude. The final option is in bifid pulse of HCM, the amplitude of tidal wave is less than that of percussion wave. So which of the above is false? Yeah, thank me.
Option C, in bifid pulse of chronic AR, the percussion wave and the tidal wave are of equal amplitude.
You think that is false? So the actual answer is the amplitude of the pulse wave decreases the distance from the heart. So as pulse goes away from the heart, the amplitude increases. So in bifid pulse, both the tidal wave and percussion wave will be of equal amplitude, whereas in SCM, the tidal wave will be more than the percussion wave. So the next question is for team B. Regarding blood pressure, which of the following is false? The auscultatory measurement of BP yields lower systolic and higher diastolic values in the direct intraarterial pressure. Korsakoff sound is considered as a diastolic pressure. Third, the increased pulse pressure can be secondary to decreased vascular stiffness. Final thing is the small cuff can overestimate BP. Which of these 4 is false? A. No, actually the answer is C. So as you hear, in the older people, they usually will have the increased pulse pressure because they have the increased vascular stiffness. So as the vascular stiffness increases, the pulse pressure will increase. So coming on to the third question is for team C. Regarding jugular venous pressure, which of the following is false? Internal jugular vein is used for exam in JVP. B is mean jugular pressure falls on inspiration. Third is during inspiration, the prominence of A wave decreases. The final one is V wave appears just after S2.
Answer is D. V wave appears after just after S2.
Actually, V wave appears after S1 is a true factor. Actually, the answer is C. Though the mean jugular venous pressure falls, there will be a prominence of A wave. So we go to the second set of questions. So which of the following is false in mitral stenosis? AF is uncommon in juvenile mitral stenosis compared to elderly. Presence of severe PH can reduce the intensity of mid-diastolic murmur. The longer the mid-diastolic murmur, severe the stenosis. The final one is A2O2 interval narrows on standing. Which of the thing is false? Yeah, team here. You can take your time.
Option D, sir.
Option?
Option D, A2OS interval narrows on standing.
Yeah, that's correct. Actually, in A2 interval usually widens on standing in case of mitral stenosis. For the team B, which of the following is false regarding mitral regurgitation? Early systolic murmur occurs in acute MR. Mitral flows mid-diastolic murmur suggests severe MR. LVS3 suggests severe MR, or the LVS4 is common in chronic MR than acute MR. Which of the thing is false?
Sir, B, mitral flow, mid-diastolic suggests severe MR.
That is one of the sign of severe MR. Okay. The option for this, the answer for this question is D. Usually S4 is always occurs in acute MR because the components of the vessel is LV chamber is not that much dilated. So it's almost always S4 is there in acute MR. For team C, which of the following is false regarding aortic stenosis? Slow racing, low amplitude pulse with narrow pulse pressure suggests severe AS. LVS4 suggests severe AS. Splitting of S2 suggests severe AS. Or the aortic adjacent plates are usually absent in rheumatic AS. Which of the four things is false?
D, aortic ejection plates are usually absent in rheumatic AS.
It's actually true. The isolation usually will be absent because of the thickened and non-palpable valve. Usually aortic adjacent leak won't be there in rheumatic AS. The correct answer for this is splitting of S2 suggests severe AS. Usually in severe AS, we will only hear a single S2. So from the first round, the leading team is team 1 with 10 points. Team B and team 3 are in the equal stage with 0 points. So coming on to the second round. So this is picture-based question. We'll be having 3 X-rays and 3 ECGs. Okay. First question will go to team B. Yeah, the question can be passed if their answer is wrong. If you answer the past question, you will get 5 marks. Okay. So for team B, this is for team B. So what is the diagnosis? One thing, this is not the consolidation.
Phantom tumor, heart failure. Phantom tumor.
Well, the phantom tumor usually occurs. It occurs in the fissures, no? It's not in the fissure. So let's go for team C.
Stomach sign, pulmonary embolism.
It's not Westermarck sign. Team A. Actually, what is Westermarck sign? What is called? So, we'll go for team A. What's the answer? No, it's not Palla sign. The answer is Hampton sump. Okay. This is a sign of pulmonary hypertension. You can see the prominent descending pulmonary arteries. There is oligamy of lungs. Okay. This is a typical of Hampton sump. So what is the diagnosis for? This is for team C.
Epstein anomaly.
That's not Epstein anomaly. Team A. Excellent. It's Egon side appearance. So this is for team A. So which chamber of the heart is found to be enlarged here?
Pulmonary bay is enlarged, so probably right ventricular hypertrophy.
Rather than right ventricular hypertrophy, for at least we have to get two views. One is AP and lateral. What is the typical chamber enlarged here?
Left atrial enlargement, splaying of the
yeah, it's a left atrial enlargement. We can double curve sign with splaying of
hilum is present.
Yes, it's a left atrium. So we go on with ECGs. This is for team B. So what is the diagnosis?
So ectopic atrial, this is there. R wave is V1 wave, R wave is
So what's the rhythm? What's the rhythm abnormality here? So it goes on with team C.
Multifocal atrial tachycardia.
Excellent, it's Matt. See the P5 morphology keeps on changing. So it's a multifocal atrial tachycardia. So this is for team C. What is the rhythm abnormality?
Accelerated idioventricular rhythm.
It's an accelerated AV ventricular rhythm. Excellent. This is for team A. What is the diagnosis? What is the rhythm abnormality here? No, it's not correct. That's fine. Then team B. Yeah, that's full screen. Always approach in a sequence. First see the rhythm, then go for QRS complexes.
Sir, atrial tachycardia.
Exactly, atrial tachycardia. The ectopic focus is low-lying atrium. It's a typical ECG of atrial tachycardia. So at the end of round 2, Team A leads with 25 points, Team C goes second with 15 points, and Team B is with 5 points. So coming on to the third round, that's purely oriented on drugs. So we will start with Team C. So which of the following is false with ticagrelor? It does not require metabolic activation. The daily dose aspirin dose should not exceed 100 milligram ticagrelor. The most common side effect are dyspnea and bradyarrhythmias. Platelet transfusion is useful to treat major bleeding. And the final is, it is safe in renal impairment. Which of the 5 things is false? Team C, Team C. No, the correct answer here is the platelet transfusion is not useful in ticagrelor because ticagrelor will act. Is right actually. Correct answer is D. Correct answer is D because the ticagrelor will act on the transfused platelets as well, whereas in aspirin and clopidogrel it won't act in the platelet transfusion. So for Team A, which of the following is false with aspirin? It acts by irreversibly acylating and inhibiting COX-1 and thromboxane A2. Inhibition of COX-2 initiates synthesis of prostacyclin, a potent vasodilator and platelet inhibitor. A third option is aspirin is no longer recommended for primary prevention unless the cardiovascular risk is at least 1% per year. Aspirin overdose associated with renal and hepatic toxicity. And the final is thromboxane B2 is used to treat aspirin resistance. Which of these 5 is false? Yeah, excellent. Actually, the COX, we need COX-2 because it releases prostacyclin and it has a vasodilator effect. That's why we don't want to inhibit COX-2 with aspirin. So this is for Team B. Which of the following is false regarding clopidogrel? It reversibly blocks P2Y12 receptors. The loss of CYP19 is responsible for drug resistance. It has a prolonged action compared to other antiplatelets, hence it has to be stopped at least 5 days prior to surgery. The drug resistance is common in Asians comparing to whites. It is a prodrug.
Sorry.
It's an irreversible block. It actually irreversibly blocks P2Y12 anyway. So going on to the second set of questions. This is for team C. Which of the following is false regarding beponic acid? It is a prodrug. It gets activated in liver and peripheral tissues. It has a high incidence of UTI. It causes hyperuricemia. The clear trial shows there is a better outcome with beponic acid. Which of the 5 is right? Is false? Actually, that is true. The right answer here is it gets activated in liver but not in peripheral tissues. That's why the complications of statins are not seen in beponic acid. For team A, which of the following is false regarding ezetimibe? It inhibits cholesterol absorption. It downregulates LDL receptors in liver. It does not found to increase liver enzymes to a significant level when added to statins. It acts via Niemann-Pick-like receptors. An improved trial shows the outcome of ezetimibe. Which of the 5 is false? Actually is true. The correct answer is it actually upregulates the LDL receptors in the liver. Okay. That's why that's the effect of ezetimibe. This is for team B. Which of the following is false with inclisiran? It's given as a subcutaneous injection on day 1, day 90 and every 6 months. It is a small interferon RNA that targets PCSK9 mRNA. It can reduce lipoprotein A. Bronchitis and injection site reactions are commonly noted side effects and it does not have any actions on triglycerides. Which of these things are false? Is false? If you attend the morning session, you would answer this question.
It can reduce lipoprotein.
That's true, man. Actually, inclisiran was invented for that only, no? Actually, it has some effects on triglycerides. It reduces the triglycerides to 20%. Okay, it's a potent drug which reduces the lipoproteinase to a sufficient level. So, coming on to the third set of questions, this is for anti-arrhythmics. This is for team C. Which of the following is false regarding ibutolite? It needs electrocardiographic monitoring post-dosage for 4 hours. It does not act on accessory pathway. It terminates atrial flutter more effectively than atrial fibrillation. It causes torsades pontis. Co-administration of IV magnesium decreases incidence of ventricular arrhythmias. Which of the thing is false?
B does not act on accessory pathway.
Excellent. It actually acts on accessory pathway. That is, it's one of the good drugs to give in case of AF with WPW syndrome. So why we need to monitor a post for 4 hours post dosage.
All arrhythmics are pro-arrhythmic.
Pardon? So it has a very high prominence of QTT prolongation. So it may convert AF into a VET. So second question for team A, which of the following is false regarding mexiletin? It is a oral drug given to treat acute and chronic ventricular arrhythmias. It does not act on SVT. Mexiletin is comparatively safer in patients with long QT syndrome. It is used to treat myotonia. And the final is hypoxia and ischemia decreases the effect of mexiletin. Which of these things is false?
Option A, sir.
No, it's actually given for acute as well as chronic ventricular arrhythmias. That's true. The answer is true. The answer here is option E. Actually, hypoxia and ischemia found to increase this effect. Okay. So this is for team B. Which of the following is false regarding adenosine? Its half-life is 1 to 6 seconds. Post-cardiac transplant patient express less X response. Does not act on accessory pathway. Methylxanthine has antagonist effect. May predispose to development of AF. Which of the following things is false?
So C does not act on accessory.
That's true. The answer here is B. Because post-transplant patient will have hyper-response to adenosine. They will have increased response to adenosine. That's why you should avoid adenosine in post-cardiac transplant patients. So that's we conclude the round 3. So at the end, of round 3, team A and team C leads with 35 points and team B is with 15 points. So we go in with the round 4. It actually has 20 questions. So anything can go upside down here. If you get it right, you will get 10 points. If you get it wrong, you will lose 5 points. Okay. So this is first slide, first photograph. Actually, these patients came to OPD with complaints of melena. So what probable cardiac diagnosis or lesion you will suspect? This is go with team C. Wait, let's go with team A. Doctor, team A. This is for team A. Oh, who pressed the buzzer first? You. Yeah, you have to press the buzzer. யார் press பண்ணப்பா? ಯಾರು ಪ್ರೆಸರ್ ಫಸ್ಟ್ so you have to answer. So it goes with team A. So what is the diagnosis here? It's actually partially right. This is because of this AD syndrome. Actually, this occurs with telangiectasis in colon. Okay. So this is the second slide for you. Name the drug with name the suspect drug that the patient is taking. What's the work on name? You expressed it.
Sir, cornea verticillata amidarum.
Yes, it's a vortex keratopathy by amidarum. It's not working right. So check பண்ணுவோம் பாருப்பா. Just we will reset the button. Working for everyone? Work ಮಾಡಲ್ಲ. So what is the diagnosis here?
Sir, mitral stenosis, fish mouth appearance.
It's a mitral stenosis, right? It's a fish mouth appearance of mitral stenosis. So, which part of the coronary artery is involved with this ECG?
LAD with LCX.
We have given the 5 options. You have to select from that. You are losing your time.
It's a proximal LAD.
It's a proximal LAD. Since this excessive anterior wall MA with lateral wall involvement, it's above, in LAD that is above the diagonal, that is proximal LAD. So we are going for the next question. Locate the culprit artery. B. So B, I got the option.
Sir, proximal RCA. See.
It's a proximal RCA. பண்ணுங்க பார்த்துட்டு first. So we move on to the next question. Which of the following are the risk factors for cancer? Yes. It goes with team B. What's the answer, Moy?
Sir, E. All the above.
It's a correct answer. So everything causes the sudden cardiac death in case of HCM. So what's the diagnosis here?
Rod spot in infected endocarditis.
It's rod spot in infected endocarditis, right? So what's the diagnosis here?
Orange color tonsil Tanger's disease.
If everything if everything says answer, what do we do? What is the option goes with A? What's the answer? You just after pressing the bell, you just wait for some time to see. Okay. So in echo, you are seeing this. So what is a commonest anomaly, cardiac anomaly, also with this finding? This is a. If you see this, what is the other cardiac anomaly you have to check out?
Bicuspid atrial coarctation of aorta.
Excellent. It's a bicuspid or coagulation of aorta. So forget about the arrows here. Which chamber of the heart is likely? A got the option. So we are saying it's left ventricle. Okay. Okay. So it's a case of mitral stenosis, straightening of lung border. So the least like cavity node is left ventricle. So name the sign or syndrome. That goes with B. B is having the option here.
So D winter.
Excellent. It's a D winter sign, right? What is the D winter sign? It's almost considered to be the equivalent of STEMI. Okay. So what is this stride or sign called? B had an option. B is having the option. You're just having 10 seconds more.
Crochet signs.
It's not Crochet sign. It is called as a Goldberger triad or Goldberger sign. What is Goldberger sign?
LVH type of hypertrophy.
No,
Low
it's
limb
not.
voltage in
No,
low limb
not-
voltage.
yeah.
V4 RVS in V4 less than 1 and left ventricular type of hypertrophy.
It's not hypertrophy. It's time called as a DCM. So it's just patient is having LV dysfunction. So what is the sign or syndrome here? Team B got it. You have 15 seconds more.
Sir, Brugada.
It's not Brugada.
It's a type A valence.
So it's a type A valence. What is type B?
Deep T inversions.
It's almost like D winters. Okay. So what procedure the patient had underwent? Team C.
It is percutaneous.
It's percutaneous only, it's not open surgery. What type of procedure they have undergone?
Tab.
It's not TAVI. Any other guess? Any other team? It's a lead, it's pacemaker. Okay, it's a pacemaker in the RV apex. It's not ICP. So what procedure the patient have undergone here? Team B got it.
IVC filter.
Excellent, it's a IVC filter. So, moving on to the next question. So what procedure the patient is undergoing? Team C. What is the procedure the patient is undergoing?
Percutaneous coronary.
Percutaneous?
Coronary. Balloon angioplasty.
For what? What is the actual term?
Percutaneous coronary.
It's a balloon valvotomy. Okay, right. So what the procedure patient has underwent here? Team B. What is this actually? Can you able to appreciate? It's more obvious on the lateral view.
Are we pacing?
Team B have pressed their buzzer. Where is the pacing? Where is the pacing wire? It's not pacing. Actually, it's called as a mitral clip, mitra clip. Okay, they have just stapled the edge of the two mitral leaflets. So that's we conclude. So the winner is Team C, which goes with 90 points. And there's a close call between A and B. Team A gets second place with 65 points, and Team B gets third place with 60 points. Okay. It's a very good play, thank you. Team C and Team A. To come out to get the prize amount.
You are from Tirunelveli Medical College, MD PGs, right? Which year? Huh? Finally. Okay. Thank you, Pharma team, for sponsoring us for this wonderful conference. Sun, USV, Zydus, Lupin, Ranmark, Abbott, Viva, and Citric. Thank you everyone for your participation in this conference. Thank you.